Hi students, today we are going to discuss about one more short notes, very important short notes from diabetes mellitus in carbohydrate metabolism, right? So we have two classifications, one is microvascular or macrovascular, another one is acute or chronic complications. The question may be complications of diabetes or mention about the acute and chronic or micro or macrovascular complications of diabetes. Anything may be there. So the first one is macrovascular or acute complication. The first one is, we all know, diabetic ketoacidosis. How it starts? Hyperglycemia that leads to increased fatty acids, that leads to the overproduction of ketone bodies. Then your urinary finding will be ketone bodies present in urine and reducing sugar present in urine. It leads to a lot of ketone bodies, acetoacetic acid and beta hydroxyacetic acid produces acidosis. Finally, they will end up in diabetic ketoacidosis. Right? This is the first complication, diabetic ketoacidosis, coming under macrovascular complication or acute complication. Second one is stroke, that is cerebral occlusion of the artery, cerebral artery occlusion. Third one is myocardial infarction. You all know about the blockage of coronary artery and leads to atherosclerosis and hypertension also. These are all the macrovascular complications. Okay. Second one is microvascular or chronic. Chronic means long duration, acute means short duration. We have three pathies coming under chronic complications or microvascular complications. Three pathies, P-A-T-H-Y, pathy: retinopathy, neuropathy and nephropathy. Right? Three pathies. So what is the mechanism or how it forms these pathies, right? The first one is retinopathy, that is hyperglycemia. For the diabetic patients, they will go for the accumulation of sorbitol or increased amount of sorbitol in blood. They will form the cataract, accumulation, and finally they will get collected in the lens, produces cataract. This cataract go for microvascular abnormalities in retina. That leads to retinopathy. Finally, the patients will go for either blindness or vision impairment. Blindness or vision impairment. This is for retinopathy. Second one is peripheral nervous system, that is peripheral neuropathy. That is hyperglycemia leads to the increased amount of or accumulation of excess sorbitol. This sorbitol gets deposited in Schwann cells of the nervous system. Then they will go for foot ulcers and gangrene. This is for the peripheral neuropathy. Third one is nephropathy, kidney involvement. So again hyperglycemia, accumulated sorbitol. They will go for the damages of the kidney and they will produce nephropathy stages 1 to 5, 1, 2, 3, 4, 5 stages of nephropathy. Finally, they will end up in renal failure. So, if your question is diabetes mellitus complications, means you have to classify microvascular and macrovascular and one by one mention the names. After that, if you have time, you go for any explanation. Otherwise, the name itself enough for your first MBBS complications question, right?